Welcome to Access Amplified, the podcast where we shine a light on how digital health is helping to increase access to care and advance equity around the world. I'm your host, Joanna Brownold, and our podcast is brought to you by Taito Care. Today, I'm joined by my good friend Sheila Freed, who is the Clinical Operations Director for School Health and Senior Care at Avel eCare. Sheila, thank you so much for joining me today.
My pleasure.
Sheila has been a nurse for more than 40 years, and she's seen healthcare really from every angle. And we're going to talk a little bit about that today, from busy city hospitals to tiny rural ones where you might be the only nurse on duty all night. She's also taken this cross-section of healthcare, both in the days before telemedicine, and also now she's able to shape a world where that kind of isolation doesn't exist thanks to telemedicine today. So we're going to talk about that journey and how that has impacted how she's able to give care. So let's start really with where you started, because your journey in healthcare is very interesting. You've worked at a 700-bed Chicago hospital and a 20-bed rural facility. So how did that move from a huge urban center to immediately into a very small and very staff limited rural facility help shape your understanding of what care delivery can look like and should look like?
Yeah, I think that I grew up rural, so I wasn't unfamiliar with rural healthcare. I got my degree from the University of Wyoming, but I had worked in a Chicago hospital. That was really my first job. My first 5 years of practice was in those big city settings where you always had support. You were never the only person. You always
Right.
had support. And then when we moved to a small town of 800 people in rural South Dakota, and I was interviewing, and they were like, and on the night shift, there's one nurse and two aides. And I was like, wait, I'm that nurse? Because this was a whole different spectrum than I never experienced before.
Uh-huh.
And it wasn't, I knew ICU 6 feet deep, but I did not know OB, emergency room, long-term care. And yet I was responsible for everything. And it really was me. And so
Right.
I said that was really when I became a RN, a real nurse, because I understood nursing in such a different way than I had in my urban hospitals. And you really develop your on-site team, but you only have so many hands.
Right. And had you done all of your training as part of your qualifications also in urban hospitals, or had some of that been across rural locations as well?
So my internship for my degree was in a more rural hospital. It was
Uh-huh.
probably 100 beds, but for Wyoming that was not considered rural. It was probably in the largest city in the state, although that was probably 60, 70,000 people.
Right.
Um,
But that's
so
also significantly different to a 20-bed
significantly
hospital.
different.
So that must have been quite a shock to your system. It would have been to mine, I think.
It was a shock to my system.
You said to me when we were prepping for this that you feel digital health deep in your soul because you really did practice it long before it existed. Can you tell me a little bit about that? And then maybe even share a story of what it's like to have virtual health today as a lifeline versus what that felt when you moved into that tiny rural space those years ago.
Yeah. I think, like you said, the reason I am a believer in digital health is because I was in those situations where, on a situation on a Christmas day, our physician was 20 minutes away. We had someone come in that had arrested. And at that point in time, I was ACLS certified. We had the ability in the state I lived in to intubate, but I'd only done it on mannequins. And the person that I was intubating was a mother of my friend. And so I had to try, but it was not successful. And then our physician wasn't there yet. My friend got there, and I was the one that had to share that their parent had passed away. So
Wow.
the first time when I was here at Avel and I saw them do the laryngoscope, so on site, the laryngoscope, our providers can see exactly what their providers see and can adjust, help them, guide them to intubating someone. Literally, it brought tears to my eyes
Right.
because I had been in that situation where I was the only solution, but I wasn't the best solution. And now when you see it and you experience it, even though I'm on the other side, there is just a visceral reaction of how the digital brings the support that's needed.
Yeah. Especially in those that's a really hard situation to be in. And we're going to talk a little bit about that kind of support needed for those rural healthcare workers. But that is definitely something that would be heartbreaking to go through. I want to jump now to the school program at Avel, which you've been running. How many years have you been running the school program for?
9 years. It's been
9
in
years.
existence for 10, and I've been the lead for 9 years and have
For
grown
9
up
years.
with the team.
Okay. I want to talk a little bit about what kind of parallels, because you have said to me before that a school nurse is an island in a sea of educators, and I have quoted you multiple times. So I don't know if that's weird for you, but you're on the record. Let's talk a little bit about what parallels you see between rural nurses and school staff. So both of them are kind of these islands dealing very, very alone in their work, and how telehealth can really give both of them the confidence that they need to really be able to care for their patients efficiently and calmly and with support.
One of the things I love about the telehealth in the school setting, especially in those small rurals, or it can be a larger school too, where there still isn't a nurse presence, is that we people that are in a school setting are there because they really want to give good, safe education to kids. And we have many kids that come with medical needs or their medical needs that come up. And so school staff does what they need to do, but they're not trained in any kind of medicine except maybe first aid. And so for them to be able to push the button and have that immediate support, it honestly saves lives. And you think about your own children or the children in your life, and one loss is too much. One
Mhm.
loss is you might be able to say, oh, it's less than 0.01% that is lost. But if it's your child, it's your whole world.
Yeah.
And so to be able to support these school staff who are trained to be in education, and yet these medical situations arrive or arise, or that if we give them enough support and we make that plan of care, when something does happen, they know what to do, and then they call us and we support them through that. It is just a game changer.
Yeah. And when you think about the tools, so you're saying, they push a button. What does that look like? There's tools that are available today that, maybe you didn't have previously or didn't exist previously, like telemedicine, ambulances, remote guidance in the ambulances. You mentioned laryngoscopes. What kind of advances have really most changed what's possible for rural care delivery?
I would say there's a couple of things because it a little bit depends on the setting. But one of the things that's been super impactful in the school setting is just that ability to listen to heart and lungs, that ability to look in ears and the throat, because it literally saves parents hundreds of miles when you think about over time. Because many times these rural settings of the school, the parents work someplace away. So they have to come back, get their child, then drive, so that might be an hour, 60 miles to get your child. Then you have to go back 60 miles to see where there's a clinic. And then you come back again to bring them home. So it's that saving miles just because we give the parents an idea what we actually see. And
Uh-huh.
then if I shift and I think about the ambulance, when I worked in my small hospital, if it was a very critical patient, a nurse needed to go with. So being that nurse in that ambulance, I would have what I needed as far as the assessment equipment, but I wouldn't have the guidance that I needed. I
Right.
would have to wait 2.5 hours to get to our next biggest hospital to actually have input. And so to have it in real time about what you need to do with the right kind of guidance makes 100% all the difference. Just tell a quick little story. I was in the ambulance and I was with a child who was between 1 and 2. It was a young child that was in status epilepticus. And I was 60 miles from the next hospital and 60 miles from my hospital that I just came from. And I was concerned that I was going to lose this kid.
Hmm.
And so I had to make that decision as a nurse to turn around. But I would have loved to have the input like we have today, where the physician, I could have told what we were having, and then the physician could have guided me, and I would
Yeah.
have known what to do in a better way. So there was not a bad outcome, but it was just by the grace of God.
And that's so interesting as well, because I assume that when the nurse is going with on an ambulance, you're then in a position where you're even more understaffed at the local hospital. With
Yeah.
that kind of support, is that something that paramedics, the ambulance staff themselves, will be able to do to prevent a nurse having to leave their station in the middle of a shift?
Yes, if you had paramedics, but we didn't have paramedics. We
Okay.
had BLS providers. So
Okay.
these are community providers that have volunteered, and they do a wonderful job, but we didn't have paramedics, which was why a nurse had to go.
Got it. And now the setup now is is it the same, or is that adapted as well?
I mean, our small situations, it still is the same, which is
Mhm.
why that impact is so great
Right.
when you can immediately talk to that ER physician, because you can get treatment started on the way to the highest level of whoever is trained in the ambulance.
That's such a massive difference. I mean, lives, that's
Oh,
literally lives being saved right there with that
yeah.
development. I want to talk a little bit about staff support because, you've already mentioned two stories of situations that you were in which were really difficult to deal with. This is something that doctors, nurses, healthcare professionals deal with day in, day out. But when we're looking at rural staff where we know that there's massive shortages and there's a lot of burnout and there's a lot of movement often out of rural areas, if they're part of a very small team of their clinics, and especially in those kind of small communities where people who are walking through hospital doors might be your neighbors, they might be your friends from church, they might be the person that you just said hello to in the grocery store, what kind of support do they need, and how is Avel eCare's model helping those clinicians, giving them that support and helping them through those personal moments?
Yeah, so one of the things that you have to think about, just like you said, is that with HIPAA, for one thing, you can't talk to anybody about what you just experienced, and you have a limited resources in your own small town to what you have to support you through the trauma and really the secondary trauma that the healthcare providers experience. So one of the things we do at Avel is it depends a little bit on the program, but if you think about the emergency room or that ambulance, we do that follow up with just after we've gone through whatever the situation is. There's that follow up with the local staff that says, like, what could have we done better? How could we support you? And if it is really a traumatic incident where, let's say it's someone of their own staff, they all know well that they've been having to take care of, we lean on our behavioral health support here to have an official debrief where we really use our behavioral health team to help debrief the on-site staff so that they have a place to put that trauma. And then if I think about we turn and we look about the school staff, sometimes that is really who do they talk to after they've been through this scary situation, even though they were not the one in charge, the nurse on the camera was the one in charge. They're still so affected greatly. And so we always make sure we do that follow-up care, like just, an hour or two later, just calling on to check
Mhm,
on you, see how you're
mhm.
doing. You did a great job, that encouragement, giving them a chance to discuss what happened. And I think that is like the almost a superhero factor because that digital health brings. Because the clinical expertise saves lives, but that kind of support saves careers
Yeah.
because the burden becomes very heavy if you are in those small hospitals, or can become very heavy as you deal with the grief, and it's complex grief. And so if there's a place that you can help to have someone else support that in a way that is safe, I think that it is just a benefit that you can't even quantify.
Yeah. Yeah, and absolutely. And a lot of these, I mean, when we're talking about big hospitals, those support systems might be built into that, right? There was a traumatic incident, there was a debrief, maybe they did a deep dive later on to understand exactly if something went wrong. But in the meantime, there is a psychiatry department. There is a team
Right.
of people who are there to look after the doctors. And that's obviously completely not the case in rural hospitals, and even more so not the case in schools where the person who is dealing with the incident might not even be medically trained. How does that, I mean, is that coming from Avel? Like you're reaching out, you're saying, okay, you're like flagging this incident needs follow up, or are they also able to reach out to you? How does that work?
Both ways, both
Okay.
ways. I think that the Bell staff recognize when things are traumatic, and so we automatically reach out as part of our process, but then we also invite our customers to reach out too, and it's interesting, I was just on a call actually with some senior care facility where we also provide behavioral health supports to them, and they were just mentioning in passing, they don't even have a psychologist really within a 4-county region
Oh,
that can
wow.
serve these people. And so it makes that telemedicine piece, even that access piece, even more important. So
Hmm.
even if these in that region, even if those small nursing homes want someone to help support them, there's no one local in their region. And so we really do are that virtual partner. And it's important.
Yeah. I mean, behavioral health is obviously so fitting for the virtual care. Is Have you seen the impact of this? Like, do you know if there's been fewer people moving out of the profession, or I mean, that's kind of, I guess, the very big picture. But even on a personal level, do you have feedback or kind of insights into how the impact that this is making?
Yeah, we have one. I have a couple from the school setting where the secretary has told the superintendent, like, if you get rid of the our nurse, I'm going to quit
Oh,
because I'm
wow.
not going to do this by myself, Um, and I think she was joking, obviously, but there was a seriousness to what she was saying. And we've served that school for probably 7 years, I believe. And so the relationships are developed. And so you really do develop those relationships with the school staff and you become part of the team. And so it does help for people to feel supported. And I know just anecdotally of some providers that have done those small hospital, rural stints or being in that rural area. And it's what they talk about what Avel does is it gives them that sense of community so they're not out there by themselves. So, yeah,
That's so
it's good.
important. So important when it comes to providing rural care. I mean, that I can't imagine. I can't even work from home 5 days a week. Like, I need to be around human beings. I can't imagine having to work like that and also make life and death decisions. That would
Yeah.
be, um, well, it would be very bad because I'm also not a trained medical professional, so that would go very wrong very quickly. Let's talk about you for a minute before we wrap up. You have been at Avel eCare for over 9 years, and we've spoken for the last 4 years, I think. And every time that we speak, I love our conversations because you're always, first of all, full of information and knowledge, and secondly, always so enthusiastic and happy. And I'm sure there are times that you're not, and that's okay too. But I'd love to hear a little bit about what keeps you inspired, and what you're most proud of in the work that you're doing.
Yeah. I think what keeps me inspired is the people I work with here and the people that I lead because there really is a collaborative effort on both sides. And if you don't have someone you can have one of the things I've learned, I think about telemedicine is that you can have someone that is very skilled on the telemedicine side. But if they do not have a collaborative spirit, it
Uh-huh.
doesn't always work because it really is collaboration between the on site and the virtual care that gives the best care of the patient. And I think that what I am always so struck by is how our providers really want to help. And I think that inspires me. And then I also have the privilege of getting to train on-site staff. And then I see these on-site people who really want to learn. They they have a lot of responsibility on their shoulders, and yet we really honestly can help. And it just also is very inspiring, I think, honestly, when I see these young nursing home director of nursings that maybe that's their first administrative type job
Mhm.
and their enthusiasm and yet also feeling overwhelmed and being able to encourage and say, we take one thing at a time, and this is how we can partner with you. And the
Mhm.
same thing with the school setting, with when we have nurses that come from a hospital setting and then they are suddenly the school nurse and they're the only school nurse and there's nobody to train them. And how our nurses come alongside of them and teach them how to be a school nurse. And so I think what makes me excited is how we really get to help provide quality care, but get to help support the staff. And that is what energizes me. I've lived the other side and I loved working rural. That is where my
Yeah.
heart is. But their virtual aspect just allows people to be more productive, more supported, and we get to keep our people in the rurals that we need so much.
Yeah.
And we also get to have that level of expertise to take care of everybody. So it shouldn't matter where you live, what kind of care you get. And so
Yeah.
I think that's what that virtual care really does.
Yeah. I think that's really special. You get to provide this kind of safety net, support
Mm.
them emotionally, also medically, and also, especially by going out into the communities, you're seeing the impact of the work that you're doing as well, which is really important. Thank you so much, Sheila, for talking to me today. I really appreciate it.
Well, I love to talk to you, you know that. And I
I
love to
too.
talk about things that make a real difference in healthcare and virtual care does.
Thank you so much.
All
To
right.
everyone listening, if you enjoyed today's conversation, please be sure to follow or subscribe wherever you get your podcasts. We release new episodes every 2 weeks. Please be sure to share this one with a colleague who is passionate about digital health access or rethinking care delivery. Access Amplified is brought to you by Taito Care. I'm Joanna Brownold. Thank you so much for listening, and we will see you next